Hello, I'm Gabriella Fernandez and I work at White Plains Hospital and in the administration office.
I am Dr. Paul Pechman. I am a pulmonary physician at the White Plains Hospital. Thank you for joining us for this video podcast about emerging trends and technologies.
In this video podcast, we will be speaking to you about an emerging technology in medicine. We will speak about telemedicine and how it affects patients, physicians, and hospitals. Telemedicine is the remote delivery of healthcare services, such as health assessments or consultations, over the telecommunications infrastructure. Telemedicine allows healthcare providers to evaluate, diagnose, and treat patients using available technology, including video conferencing and smartphones, without the need for an in-person visit. As physician groups and hospitals seek more efficient ways to provide care at less cost to the patient, telemedicine's role has grown. Telemedicine is often a time-saving way for a consumer to see and speak to a clinician for minor and non-urgent medical needs instead of going to a primary care physician's office or emergency department. In recent years, many states have passed laws that make telemedicine easier to practice, and federal health regulators are also exploring ways to further grant Medicare reimbursements for telemedicine services. The first type of telemedicine we will mention is remote patient monitoring, also known as telemonitoring. Telemonitoring allows patients with chronic diseases to be monitored at the bedside and is not dependent on a healthcare provider being directly present.
Patients can be in their homes with mobile devices that collect data about blood sugar levels, blood pressure, or other vital signs. Remote caregivers can review the data instantly and immediately intervene in the hospital or other environment. The second type of telemedicine is store and forward, also known as asynchronous telemedicine. Asynchronous telemedicine allows providers to share patient information such as lab results with physicians at other locations. This method enables specialized consults without the need for the consulting physician to be directly with the patient.
The third and most common type of telemedicine is interactive telemedicine. Interactive telemedicine allows physicians and patients to communicate in real time. These sessions can be conducted in the patient's home or in a nearby medical facility. All communications must be compliant with HIPAA confidentiality regulations.
Interactive telemedicine is used to effectively diagnose simple medical issues such as insect bites or small injuries, which can be evaluated in a video chat. These telemedicine services have the potential to result in significant cost savings, and there are a variety of payment models to fund telemedicine services. Some health systems offer telemedicine consultations as part of their regular care services. Some patients can opt to independently use a telemedicine vendor for a flat fee, which is often less expensive than going to a medical office or urgent care setting.
Some of the benefits of telemedicine for patients include convenience. Patients do not have to take time away from work for an appointment. There is no travel time or associated expense, such as paying for parking or childcare. There is increased access in remote areas. Patients in rural areas can now benefit from specialty services such as mental health treatment, which was not previously available. Post-op follow-up is now easier for many patients as well who live in remote areas since they do not have to travel a long distance for follow-up. The advantages of telemedicine for providers include a reduced number of cancellations or no-shows. Telemedicine can also contribute to health monitoring for chronic illnesses and promote healthy lifestyle choices, such as smoking cessation or diabetic meal planning. Any technology that involves electronically transmitting patient data, including telemedicine systems, are potentially susceptible to hackers and breaches. Healthcare organizations are a major target for online criminals and terrorists.
Clinicians will need to learn how to properly evaluate patients and generate documentation in a telemedicine setting to ensure safety and value for this new type of healthcare delivery. One of the greatest risks of telemedicine is the follow-up of a patient's condition, their evaluation, and treatment. This risk has been recognized by the Joint Commission for the Accreditation of Hospitals. The potential compromise of patient safety has recently been discussed in the Joint Commission publication Sentinel event. The transfer of information regarding the patient's telecommunication evaluation and the necessary follow-up deserves standardized protocols, forms, and checklists. There will need to be monitoring of this new technology and scorecards to evaluate compliance with these standards. For example, if a patient has a telecommunication with a healthcare provider, what type of documentation will exist? And will this communication be recorded for later review? The details of the interaction and the recommendations can be very detailed and need to be specified for later review. Responsible care coordination is necessary to ensure patient safety and continuity of care for the immediate condition being treated, and it is necessary for effective longitudinal care. Numerous prominent medical organizations, major universities, medical centers, and physician organizations have supported the concept of telehealth and telemedicine in numerous specialties and locations.
There is a recognition that there can be potential hazards. The Mayo Clinic's blog in 2017 stated, while telehealth has the potential for better coordinated care, it also runs the risk of fragmenting healthcare. Fragmented care may lead to gaps in care, overuse of medical care, inappropriate use of medications, or unnecessary or overlapping care.
There is a concern by government and healthcare alike about potential fraud and deceptive billing using telemedicine technology. In April 2019, federal prosecutors charged 24 executives in telemedicine companies and the owners of durable medical equipment companies with a $1.2 billion telemedicine fraud. This scheme included kickbacks and enormous expenses for unnecessary durable medical equipment at taxpayer expense.
Government and industry surveillance of telemedicine to minimize and detect fraud and abuse will be necessary. There are many potential benefits for the patient. Many healthcare encounters can be effectively and efficiently delivered with this technology. Certain issues clearly require direct examination and evaluation by a healthcare provider.
Safety and value need to be maintained. Documentation of the telemedicine encounter and continuity of care subsequent to the virtual visit must be preserved to maintain the integrity of healthcare delivery. The utilization of telemedicine can be a positive contributor to our healthcare system. Its utilization must fall within the ethical, compassionate, and patient-oriented values that the medical profession embraces, as exemplified by the Hippocratic Oath to uphold ethical standards and to always treat patients to the best of our abilities.
Thank you for joining us for our podcast about telemedicine. Again, I am Gabriella Fernandez.
And I am Dr. Paul Pechman. Thank you.